So it's time to study smart. Let's make use of past question for menstrual and ovarian cycles. So here are questions that they may ask you. So let's dive into past question. During which phase does the endometrium begin to rebuild after menstruation? During which phase does the endometrium begins to rebuild after menstruation? So first, the little phase. No, little phase is ovarian cycle. So this is out of the way. So number three said at the ovulation phase. So at the ovulation phase, what is happening? We are releasing egg. So three is out of the way. So number two said the menstrual phase. So during the menstrual phase, endometrium shedding off is occurring. We are shedding off the uterine endometrium. So it is out. So the answer is what? A. What is happening to A? Proliferative phase. At the proliferative phase, that is when the endometrium begins to rebuild after menstruation. So our next question is, what is the common outcome if the corpus luteum degenerates and pregnancy does not occur? What is common outcome if corpus luteum degenerates and pregnancy does not occur? So if corpus luteum degenerates, that simply means fertilization does not occur and progesterone is not secreted, and it now leads to what? Shedding off the endometrial lining. So increase in estrogen level, no. So this is number one, is out of the way. Estrogen is not increased after luteum have degenerate. Second one is maintenance of the uterine lining. No, uterine lining is maintained due to secretion of progesterone, and it is done by corpus luteum. It have degenerated, so it is not possible. So third said shedding of the endometrial lining, and fourth say formation of new follicles, which is bad. So we are not forming follicles here. We are shedding off endometrium. So during this phase, shedding off of the uterine endometrium is occurring. So we have which which of the following describe the follicular phase of the ovarian cycle? Which of the following describe the follicular phase of the ovarian cycle? So the ovum is released from the ovary. No, the ovum is not released from the ovary. So this one is out of the way. The endometrium shed its functional layer during this phase. Look, remember the question, which of the following describe the follicular phase of the ovarian cycle? Follicular phase is all about development of what? Follicles. So it's not all about ovum is released from the ovary during this phase. Endometrium shed off in the functional layer during this phase. It involves growth and maturation of ovarian follicles. So this is not it. We are talking about ovarian cycle. This is menstrual cycle. It involves the growth and maturation of ovarian follicles. So that is our answer. So next question is, which of the following describes secretory phase of the uterine cycle? Secretory phase. So what is the secretory phase of the uterine cycle? The secretory phase of the uterine cycle is when the endometrium thickens and become nutritional, and it is now better environment for implementation of the embryo. So it is primarily stimulated by follicle stimulating hormone. No, it is not stimulated by follicle stimulating hormone. It occurs before ovulation. No, it occurs after ovulation. Uterine cycle, especially the secretory phase, occurs after ovulation have taken place. Ovulation takes place in 14 days, while secretory phase takes place from 15 to 28 days. Progesterone level are high during this phase, correct, because corpus luteum starts secreting progesterone which are high during before secretory phase can now occur. So the answer is this.